So you, NHS England, you fail to put that speciality training in place, and then you go down and close clinics down because they've got no specialists. How do you make a specialist if there's no specialist curriculum and no specialist training program? Is it like every single person that comes to a GP surgery must undergo a biopsychosocial assessment before they're allowed to have any care? Or is it just if you tell people you're trans? But what you actually mean is, did they undergo an assessment where we could sit down and go, don't you think it would be better if you're not trans? So you're saying now, we'll close this clinic, all 78 children and young people will get referred to NHS Children and Young People's gender services, where they will be able to continue their puberty blockers and gender-affirming hormones. No, that's not true, is it? No, you're lying to me. You're lying to me and you're lying to everybody else. So let me just tell you what needs to happen in this country. A patient safety investigation into the clinical approach of WellBN Brighton. It was undertaken to identify patient harm and potential harm. So it wasn't undertaken to evaluate the service. It wasn't undertaken to evaluate gaps in the service provision for gender incongruent young people. It was undertaken to identify patient harm and potential harm. Okay, well, if that's what you want to go and find, that's what you're going to find, isn't it? And obviously you did. But was it right? Was it the right finding? And was your action the right action? So they did it also to identify action required to ensure patients are supported and receive high quality care, and to provide recommendations for actions. Who were the experts? Who did they call upon? They didn't ask me to have a look at it, and I am a gender expert. I don't think that they've asked any members of the WPATH to have a look at it. I wonder what they asked of the patients and the parents. I wonder what their input was. And who carried out this investigation? Let's have your names. I mean, pardon me if I'm wrong, but I haven't seen them. Which specialists did we get in to actually do the review? Did they have any clue about the management and care of gender incongruent young people? So you said that this clinic's no good, so you've shut it down. And how long are we going to have to wait for you to put something in place to supersede it, to actually cater for the needs of gender incongruent young people, young adults and their families? How long is it going to take you to do that? Because there's nothing at the moment. So you close this down in order to see what's needed, and then you don't put anything in place. So the practice was not commissioned by NHS England or the ICB to provide specialist care to children and young people. Maybe you didn't commission them to do that, but being a doctor, being a general practitioner means you look after the whole of that person, all of their health, all of that care. And maybe NHS England and ICB, maybe you should have commissioned someone to provide the care, because as far as I can see it, nobody's providing the care at the moment at all. But that doesn't mean the patients don't need the care. It just means that you are not providing it. And it seems to me that you're going around excluding and shutting down anything you possibly can that will provide that care. But what are you doing in the meantime? What are you doing to replace it? Because the people need that care. And if they don't get the care, then they are in trouble. And we all know what happens. Mental health declines. People don't feel very well. And the end result is self-harm and suicide. We've seen it, and we're seeing it in the coroner's reports. The practice staff providing care recognised that they were not specialists. They're not specialists because there is no specialist training in the United Kingdom for people helping other people with gender dysphoria and gender incongruence. There isn't any specialism. It's not named in any of the GMC and Royal College curricula. So what happens is you've got your Royal College of General Practitioners, your Royal College of Paediatricians, your Royal College of Endocrinologists, and they write a curriculum for the doctors so that the doctors know exactly what it is that they're supposed to know about. And if you look through all of those curricula, gender incongruence is not mentioned as a field of medicine to be a specialist in. So you, NHS England and GMC and the Royal Colleges, you fail to put that speciality training in place, and then you go down and close clinics down because they've got no specialists. How do you make a specialist if there's no specialist curriculum and no specialist training program? It's a vicious circle. Whatever are you supposed to do? Care at the practice for the 78 children and young people fell substantially below that set out in service specifications and national clinical policy. But I'm just thinking that actually you said that the practice was not commissioned by NHS England to provide that care. So what service specifications were they supposed to be going along? Puberty blockers and gender enhancing, actually called gender affirming medications, gender affirming hormones, that's the clinical word. If you get the actual real rule books out, gender affirming medication, not gender enhancing medications. What are you talking about? They were prescribed without a comprehensive biopsychosocial assessment. What is one of those, please? Is it like every single person that comes to a GP surgery must undergo a biopsychosocial assessment before they're allowed to have any care? Or is it just if you tell people you're trans? But what you actually mean is, did they undergo an assessment where we could sit down and go, don't you think it would be better if you're not trans? You're probably putting it on. You're probably being forced there by your parents. You probably had something terrible happen to you, and that means that you're coming along saying you're trans when you're not really. That's what you mean by biopsychosocial assessment, isn't it? Well, I'll tell you what I mean by biopsychosocial assessment. I mean, hello, you say you're trans. I believe that you're trans. And how would you best like me to help you? Sorry to interrupt. Thank you so much for being here. Thank you for listening. Thank you for watching this video. I notice that some of you don't actually subscribe, and it would really help me if you did subscribe, and it will also make sure that you can get my next video if you want to. So just click the button. 22 cases without even face-to-face appointments taking place. Excuse me if I'm wrong, but I reckon that there are virtual appointments with doctors going on all over the country, all over the world. Now, I haven't looked into the specifics, and I'm seeing people online saying that those findings, that's not true. I got blood tests, I got seen, I got assessed, I got all those questions asked. So is it just that if you have a normal medical condition, you can have an online consultation? But if you've got one of those weird ones, the gender incongruence ones, the ones where you pretend to be trans and no one believes you, then you have to come in and be seen face to face. Stop othering transgender people. It's not nice. 75 cases without referrals to paediatric endocrinologists. Excuse me, have you got that list of paediatric endocrinologists who have sufficient skills and knowledge in this area to help GPs and nurses and practice staff with this? Because actually, if you remember, you closed down the Tavistock clinic, so they've all gone. They're not practicing in this field anymore. Which ones is it? Because there's no specialist training for this. If you look at the paediatric endocrinology curriculum, gender incongruence isn't on it as a specialism. And actually, if you ring up most hospitals with a paediatric endocrinologist and say, can you help them? They'll be like, no thanks, not me. So yes, you can criticise them for not phoning up and not referring to paediatric endocrinologists. Which ones? There aren't any. On the basis of the available records, the children or young people's capability to consent was only confirmed in 6 of the 78 cases. Now, I had this in my case as well. If you didn't write it down, specifically, you're accused of not doing it. But actually, doctors and patients talk all the time. And you know what? Doctors don't give people medication if they're not competent to know what that medication does. So, of the available records, they apparently only found 6. I wonder if someone else had been looking through those records, or if we'd actually asked the patients or actually seen the patients ourselves, whether we might have had a different number on that one. The absence of an extended assessment and diagnostic process. So we heard that the children and young people were already distressed, but yet the absence of an extended assessment and diagnostic process. So what are we talking, like 6 weeks, 6 months, 6 years? What is this extended? Do you know what? Imagine if you had breast cancer and they said to you, sorry, before we're going to do anything with your breast cancer, we need to put you through an extended assessment and diagnostic process. Like, when we've established the diagnosis, that's not enough. We've just got to extend it a bit more. No, you telling me that you're transgender, that's not good enough. No, I can't possibly believe you. I need an extended diagnostic process. So this increased the risk that a child or young person and parents were not sufficiently informed. Why would an extended assessment and diagnostic process mean that there was a risk that they were not sufficiently informed? That doesn't make sense. Are you saying that the extended assessment and diagnostic process was to make sure they were trans? Or are you saying that it wasn't an assessment and diagnostic process? It was an information giving process where we make sure we've given you enough information to make an informed choice. There's a difference there. The purpose of giving informed consent, possible gender dysphoria treatment options. You know what they mean by that one, don't you? So there are possible gender dysphoria treatment options. 1, do nothing and send you away. That's what the NHS is doing with them all at the moment. 2, psychotherapy, CBT, counselling, anything so that we could sit down and talk to you for long enough that you just get bored of talking and go, I can't cope with this anymore, and go, all right, I won't be trans anymore. That's what you mean, isn't it? The alternative. Oh, sorry, maybe not. Maybe you just meant the gender dysphoria treatment options, which are puberty blockers to stop puberty progressing in an uncomfortable way for that young person, gender-affirming hormones to make sure we get the right puberty, and then counselling and psychotherapy to support someone during their transition. Those are the options that we're talking about, including the potential risks, benefits, harms, and known and unknown outcomes of gender dysphoria medication. It's just so loaded, isn't it? It's just so loaded. You don't know what you are doing. You don't know what you're going to go through. You don't know how much you're going to regret this in the future. You don't know. Do you know why? We don't know whether you know or not, because we don't listen to you. Prescribing was assumed or initiated by the practice in the absence of advice or support from a specialist consultant-led paediatric endocrinology team, increasing the risk of physical harm. Please, on the fingers of one hand, give me the names of specialist consultant-led paediatric endocrinology teams that have the skills and knowledge to manage gender incongruent patients. Oh, you only have to get to 5. Okay, 4. No, all right, 3. Okay, give me 1. Give me 1 team in the United Kingdom at the moment that GPs can refer patients to get timely gender-affirming care. Children and families were not appropriately informed of the impact of medication on fertility and options for gamete preservation. So we've got a 14-year-old. What are the options for that 14-year-old on the NHS to get gamete preservation? Which clinic is it that is going to go say, yes, come here, 14-year-old, come here on the NHS and give me your sperm and eggs and I'll put them in the freezer for you? The overarching safety recommendation for the cases reviewed is that all children and young people registered with the practice who've been treated for gender incongruence or dysphoria should be referred to NHS Children and Young People's Gender Services. Oh, they're up and running, are they? They're coping with demand, are they? They've got plenty of capacity, have they, to see these 78 children. So you're saying now, we'll close this clinic, all 78 children and young people will get referred to to NHS Children and Young People's Gender Services, where they will be able to continue their puberty blockers and gender-affirming hormones. No, that's not true, is it? No, you're lying to me. You're lying. You're lying to me and you're lying to everybody else. And you're lying to that 78 people that you've destroyed. So let me just tell you what needs to happen in this country. We need to understand that transgender children of all ages exist. Every single transgender adult was once a transgender child, and we have very many transgender children in this country who are going to be experiencing or may experience or will experience gender dysphoria. If they don't experience gender dysphoria and they're happy in their gender identity, they still need the same amount of support. Now, some, maybe not all, but most of those children and adolescents would like to seek gender-affirming care because they know it's an option. It's a bit like having cancer and knowing that surgery, radiotherapy and chemotherapy are an option, but then you're not allowed it. So transgender children and young people understand that gender-affirming care is an option, but it's not available. That hurts. So now we need to put in some standards. We need to put in some standards of education. We need to start accepting that we're going to need to start training and educating doctors, nurses, psychologists, counsellors to start providing care for transgender people urgently, because we've got transgender people asking for care and we've got no one to provide it. So can we please have some standards of education? And the standards have been set by the World Professional Association of Transgender Health, the Standards of Care 2020. So the standards are there, we just need to adopt them in this country. And then please can we have some training and education so that we can actually have a rule book by which to treat people. And I know we don't have it in the United Kingdom, but it is available. For example, Australia have made some amazing clinical guidelines, all evidence-based. New Zealand have done the same in theirs. America have some amazing pediatric guidelines. The Endocrine Society, superb. The UCSF primary care guidelines, amazing. So we have guidelines. Please, can we adopt them so that doctors can provide care safely according to those guidelines? So then we end up with standards of education, GMC, that's your job. Standards of care, GMC, that's your job. And then support for doctors and other professionals, Royal College of GPs, that's your job. Can you please get your heads together and start doing this? Because while you're just withdrawing and pulling back care, there are people, young people, children dying. And you've heard me say it before, but blood trickles down the hands and fingers of those who allow it. So stop cancelling services and start supplying services. Gender-affirming care has been proven to be safe, effective, and do you know what else? Life-saving. So get on and start providing it. And you know that bit at the end where you go, oh, sorry, now I know we understand you're going to be a bit upset, but we'll put a phone line and some mental health support in there for you. The very fact that you put in mental health support means that you understand that mental health is going to suffer as a result of your actions. Just provide safe and effective gender-affirming care. Start setting those standards. And do you know what? If you want some help, come and ask me. I'm always here. Thanks for watching, thanks for listening, and don't forget that I write about this all day, every day on my website. Come and have a visit, I'll see you there. Link is below.